Hi, everyone, and welcome to the webinar on how to optimize your diabetes care during the COVID-19 pandemic. Today's presentation is sponsored by the Good Health Gateway. I have a couple quick housekeeping notes for everyone. There is a questions section located in the GoToWebinar platform, so if you do have questions that you think of throughout today's presentation, please feel free to submit them through the questions section. We will take some time at the end to answer any questions that come in. And please note that if you do submit a question and we don't have time to get to it at the end of the presentation, we will respond to everyone individually following the webinar. In addition, there is a handout section for the GoToWebinar platform as well. We've included in this section a COVID-19 checklist that we've put together at Good Health Gateway to help you through this difficult time. Many of the items featured in the checklist will be covered during today's webinar. So with that being said, let's proceed with our presentation. Before we get started, I would like to introduce myself. My name is Sarah Costa, and I'm Senior Manager of Client Services at Good Health Gateway. I will be moderating today's webinar. I'm joined today by Cindy Sylvia and Christine Dyer. Cindy is a diabetes nurse educator for Good Health Gateway. She has been an RN for over 30 years and has worked in diverse areas, including acute care, home care, and public health, as well as teaching nursing students. Christine is a clinical pharmacist and certified diabetes educator at the Good Health Gateway. Christine brings multiple years' experience working with people with diabetes. Both Cindy and Christine will be available at the conclusion of the presentation to answer any questions that come in. I would like to take this opportunity to thank you all for being here today, especially given the challenging times that we're all facing right now. We all have new concerns, fears, and sources of stress outside of our own health that have come into our lives as a result of the pandemic. At Good Health Gateway, our goal is to help you and your loved ones with diabetes navigate through this difficult time. Our presentation today is aimed to support you in your diabetes care and provide you with resources that you can use in your daily lives. In addition to important diabetes-related topics, our webinar will include some helpful tips on maintaining self-care during this time. So with that being said, let's begin. Now more than ever, it's extremely important to maintain contact with your physician. Unless your doctor informs you otherwise, keep your scheduled appointments. If available, utilize telemedicine as an alternative to going into the doctor's. And if you have questions about your health, call your doctor. Even if your regular physician is unavailable, there is usually an on-call physician who can help answer your questions. And talk to your doctor about your current medications and if any changes are needed as a result of the pandemic. With that, I'm going to turn the presentation over to Christine, who will begin by expanding upon how to make the most of telemedicine.
Great, thanks, Sarah. Hi, everybody. I wanted to take a few minutes just to talk about telemedicine. One of the best ways to stay safe during the pandemic is to receive medical care from your home. It's a good idea to treat it like a regular doctor's visit, and you may want to bring a family member along with you. Make a list of your current symptoms, when they started, and how severe they are, and if they're getting worse. You'll want to make clear if there are any other people in your house that are ill. Keep track of your data. Do you have a temperature? Do you monitor your blood pressure at home? And what was your blood pressure today? Also, are you monitoring your blood glucose at home? Make a list of any chronic conditions and a list of current medications and dosages you are on, and be sure to ask the provider any questions that you have. In preparation for the televisit, there are certain items to consider. Are you going to use your phone, tablet, or computer for your visit? Is the device fully charged? Do you have a reliable internet connection? Does your health system use an app? If so, download it in advance of your visit. Have paper and pen to make notes during the call. And remember that telemedicine is a new experience for you and your doctor. So I want to take a few minutes to speak about monitoring your blood sugar during the pandemic. Continue to take and share your readings as normal. People with type 1 diabetes should test at least 4 times a day. People with type 2 diabetes, the testing recommendations for how often to test are based on individual factors, such as type of medications, lifestyle changes, and risk of hypoglycemia. Keeping blood sugar levels on target will help you combat illness. High blood sugar may cause complications when sick. Other considerations: blood sugar readings can be affected by different things, including level of physical activity, what you eat, stress, and medication. It's very important to remember is to share your blood glucose readings with your doctor. The more information your doctor has, more effective changes and treatments can be made. Now I wanted to take just a minute to talk about taking medications regularly. You want to continue to take your medications as prescribed. Make sure to take all medications correctly in order to prevent or minimize hospital visits or doctor's appointments. Consider getting a 3-month supply of medication, including testing supplies. Getting a 3-month supply prevents multiple trips to the pharmacy and limits exposure to the public. Get extra batteries for your glucometer and have extra alcohol swabs available at home. Remember, even if you use a mail order pharmacy, you always have access to speak with a pharmacist. Check on your medication refills a week or 2 before you need them. Be sure to contact your pharmacy to make sure refills are ready when you need them. Call ahead to make sure they are ready and use a drive-through if it's available to limit exposure. Many insurance companies are allowing early refill overrides due to COVID-19. Now, if you have an insulin pump, you want to be sure to keep up backup supplies. Be proactive to prevent running out of anything necessary for insulin pumps, like alcohol swabs, batteries, or tubing. Set reminders for when you want to take medications and when to refill medications. Use an alarm on your cell phone to remind you to take your medicine. Mark on your calendar when you'll run out of your medication so you know when to contact your pharmacy. And there are also many med reminder apps available for smartphones.
All right. Thank you, Christine. That was some really helpful information. I do want to remind everyone that if you do have questions about any of the information presented in the webinar, feel free to submit those through the questions section of the platform. With that, I am going to turn the presentation over to Cindy, who is going to talk about some important guidelines for self-care during this time. Cindy?
Thank you, Sarah. Hi, everyone. Thank you for joining us this afternoon. This portion of the webinar, we're going to focus on the importance of staying on target with self-care. Making unhealthy food choices, not coping with stress, unchecked high blood glucose levels, and the lack of physical activity can all contribute to a weakened immune system. Staying on target with self-care behaviors is even more important during this pandemic. I'm going to talk about exercise and diet in the upcoming slides. Going to focus now on reaching out to contacting your provider. Whether it's something with your health in general or something that's not quite right with your diabetes, if you're not feeling well, it's important to stay in contact with your provider. You should not delay in seeking attention with your health. Do not put your health on the back burner. I want you to ask a question to yourself. If the pandemic was not going on, would I be contacting my healthcare provider with my concern? If you answer yes to this question, you should be contacting your healthcare provider. Health problems that go unchecked can have a negative impact on your blood glucose levels. I also want to talk about taking advantage of resources such as EAP. EAP is Employee Assistance Program. It's a voluntary work-based program that offers free and confidential services. Services include short-term counseling, referrals, and follow-up. They have a broad and complex array of services that they can provide, and they are very instrumental in providing assistance during times of emergency response or disasters. Lastly, I also want to say here is that we want you to contact your doctor if stress gets in the way of any of your daily activities. Next slide, please. So nutrition is very important, and we're all very familiar with the illustration at the top of the diabetes food plate or the My Plate. Healthy eating helps strengthening your immune system. Giving into junk food and becoming a couch potato is not the answer. Fruits and vegetables are power players when it comes to the immune system. Whether fresh, frozen, or canned, fruits and vegetables can fit the bill. You want to choose varieties with no added salt or sugar, but don't stress out if when you go to the grocery store that no added salt or low sodium are not available. You can always rinse those products before using them. You do want to focus on flexible recipes that you can easily substitute different vegetables, proteins, or grains, depending upon what you have on hand. Things like stir fries, stews, frittata, and meatloaf are great versatile dishes that you can add in to substitute different things in. You want to keep on hand items that can raise your blood sugar in the event that you have a low blood sugar. Fruit juices, raisins, and bananas. With regards to having items that are on your shelf, you want to stock up on things that have a long shelf or have long shelf life. Your favorite fruits and vegetables. If you find that something is not available frozen but fresh, you can always freeze it yourself. You want to be aware of the dates of the expiration dates of your products, and you want to have food safety reminders. You don't want to thaw anything out on the counter, and you can also take your dairy products and you can freeze them before they expire. They work well in the freezer. Canned proteins such as tuna, salmon, chicken, sardines, and anchovies are great choices. You want options that are packed in water instead of oil. Canned fruit, as I said, or frozen fruit, you want the fruit that's packed in water or 100% juice. You don't want to choose an item that has heavy syrup. Broth, like chicken, beef, and vegetable broth are great resources to have in your pantry, and they can start as a starting point. And again, you don't want to purchase cans that are dented, and you want to check the expiration date. Your dry goods, whole grains such as rice, quinoa, oatmeal, popcorn are great to have on the pantry. Dry beans, lentils are great to have. Lentils cook faster and they're a great source of protein. Pasta, when you're choosing pasta, you want to look for whole grain. You might want to try a legume-based pasta or a lentil-based pasta. Nuts and nut butter, like peanut butter or almond butter, are also great sources of protein, and they're great to have in the pantry. Lastly on this slide, hydration. You want to stay hydrated. Water is essential to life. It plays a role in keeping all of our body systems working well. You want to remember the 8x8 rule. You want to drink at least 8 glasses that are 8 ounces for a total of 64 ounces every day. If you're having illness, fever, diarrhea, you could experience an additional water loss. So you want to make sure that if you're having those, you might need to have a little bit more water. You want to listen to your body. If you're thirsty, you want to drink water. You want to opt for water instead of soda or energy drinks, and you want to drink water throughout the day. Next slide, please. Physical activity, very important. Many of us have been advised by our physicians that exercise is an essential part of our health treatment plan. Current recommendations is to get 30 minutes of exercise per day. We want to start off slowly with low intensity workouts such as walking. The other thing is if 30 minutes is too much to do all at once, you can do 3 10-minute segments throughout the day. Has the same impact. You want to refrain from sitting for long periods of time. Sitting is now the new smoking, so it's important to get up and walk around throughout the day. Use what you have in your home. Don't worry if you don't have exercise equipment. There are chair exercises you can do. You can go online. There are online classes. There are also classes that EAP is also streamlining. You can use what's available. If you do not have resistance bands, you can use bungee cords. If you don't have a set of weights, you can use a 32-ounce can of tomatoes or a 16-ounce can of tomatoes, and those can be your weights. You want to remember to practice social distancing if you're exercising in a public space. You also want to be aware of the state and local mandates that they have out for wearing a cloth covering, a cloth mask. And again, that's per state and locality. If you're not feeling well, it's not advisable to exercise. And many of us have been given a set of guidelines by our provider. If our blood glucose levels are at a certain level, it's okay to exercise, but if our blood glucose levels are elevated, we've been counseled as to what to do with regards to proceeding with exercise. Next slide, please. So you want to check in with yourself and with others. Pandemics can cause anxiety and a sense of isolation for everyone. When we do not have a routine or a structure to our day, it can cause increased stress and anxiety. It can lead to overwhelming feelings, and we can then have a lack of concentration and focus. Having a regular routine can help us lower our stress levels, form good daily habits, take better control of our health, help us to feel more positive, and help us be more focused. Some things to consider when we create a routine is we want a routine that supports our health. We need to remember to stay active, get regular exercise, make sure that we're sleeping, we're well rested, eat healthy meals. We want to create a workspace that's outside of our bedroom. We want to schedule time for activities that we enjoy, and we want to stay in contact with others. These are extraordinary times, circumstances that we've never been exposed to. We don't have to be perfect. It's going to take some time and practice, so we shouldn't be beating ourselves up. It's also important that if you have children in the home, that you provide them with some consistency and structure. Children do better when they have a routine. It provides them with a sense of security and predictability, and this is important for their development. It's important to plan family activities with your children, make a schedule, place it in a spot that they can see, discuss the schedule with them, and again, it provides them some structure and a sense of security. This is a great time to start a family book reading club, and it's also a great time to start a family game night. And the other thing too is you can always remember that you can contact your human resources for additional for EAP and additional resources available. Lastly, I want to talk about Facebook, because Facebook is a form of social media. There's a lot of forums that are out there, and it's a great way of checking in with others and another great way of getting additional information. All set, Sarah. Thank you.
Thank you, Cindy. So as Cindy mentioned, the Good Health Gateway does offer a private Facebook group for our members. It's a private community and a great place to find helpful diabetes resources, as well as important program information. To join the group, simply search for Good Health Gateway on Facebook and request to join. So what is the Good Health Gateway program? The Good Health Gateway program is a diabetes care rewards program that does just that. We reward you for taking care of your diabetes and connecting you with your provider. Throughout the year, we present different webinars to bring each member information that will help improve your health and effectively manage your diabetes. Since this program is provided by your employer, each program is a little bit different, but to receive the rewards, members complete specific activities that align with the American Diabetes Association's guidelines for diabetes management. These activities include an annual fasting blood lipid, annual foot exam, an annual eye exam, an annual urine protein test, and twice yearly, the HbA1c. The good news is that any of these activities that have been completed in the last 12 months can be used towards your rewards, with the exception of the A1c, in which we look back 6 months. Now, we realize that many of you may be having trouble getting in to see your doctors during this difficult time. If you are an existing program member and would like to learn more about what you can do to receive an extension on your program activities, please contact our helpline at 800-643-8028. So the only program requirement that varies by employer is meeting with one of our diabetes educators. However, even if your program does not require this, they are still available for any questions you may have and are a great resource to help support you in your diabetes care. At Good Health Gateway, we have both diabetes nurse educators and clinical pharmacists on staff. If your doctor is unavailable during this time, speaking with one of our educators is a great way to bridge the gap. To prepare for your conversation with the educator, it's always a good idea to have the following information available: a list of current medications, your current meter and how often you take readings, and the numbers from your most recent readings. Lastly, prepare a list of questions that you would like to ask the educator. They are here to help and want you to make the most of the conversation. Contact our helpline to learn more about speaking with a diabetes educator. Lastly, our program is completely voluntary and confidential. All family members on an employee's health plan are eligible to participate, whether they have diabetes or prediabetes. So this includes the employee, spouses, child dependents, as well as adult dependents that are on the health plan. We want to reward you for taking care of your health. As I mentioned earlier, programs are through your employer, so the rewards and requirements vary. So check with our helpline or visit our website for more information. So shown on the screen here are some available resources that are available to you. They're all free. Some are from the American Diabetes Association. We have information on nutrition and physical activity, as well as some self-care tips. All of this information, all of the resources shown on the screen here are included as part of the COVID-19 checklist that we have provided to everyone as part of today's webinar. So as a reminder, in the handout section of the platform, there is a PDF attachment of the COVID-19 checklist for all of you to have available. All right, so with that being said, that concludes the webinar for today. It looks like we did have a couple of questions that came in throughout the presentation. So let me pull those up and we'll have Christine and Cindy answer those questions. So Cindy, here's a question for you. Does COVID-19 affect people with type 1 and type 2 diabetes differently?
That's a great question. First, overall, the research is showing that blood glucoses that are well managed, you have a decreased risk of having complications. There's no research that's indicating whether someone with type 1 or type 2 has a different course of COVID. You again want to focus on keeping your blood glucose levels on target. And again, if you have another pre-existing health issue, or if you're over the age of 65, you may have more likely have a little bit more of a complication with the course of the COVID. But there's no difference between type 1 versus type 2.
Great. Thank you, Cindy. We have one more question here that we'll talk about today. So Christine, one member asked, how can family members protect loved ones with diabetes or other health problems during this time?
That's an excellent question. If you or someone you live with has diabetes, everybody in the household needs to take extra precautions. Everybody should wash their hands frequently, and everybody asks how many times a day, and my response is as many times as you think to do so. Excuse me. Should a family member develop symptoms of COVID-19, he or she can protect the rest of the household by staying in a separate room and self-isolating, and always contact your provider.
Thanks, Christine. So thank you everyone for being here today. This does conclude our webinar this afternoon. As a reminder, we will be sending out a follow-up with a recorded version of the presentation if you would like to watch it again. And in addition, we'll be sending out the attachment for the COVID-19 checklist as well. So thank you everyone, and have a great rest of your day.